lasers are something that's great for fall, really any time of the year, especially the one that I'm doing called the Clear and Brilliant. But we call fall laser season or Fraxel season because it's cooler outside, and so it's just not as fun maybe to get a hot laser during the summer. But what's great about the Clear and Brilliant, and that's the one I'm getting, is it is a baby Fraxel. And so really it's meant to be done in succession. So I'm gonna do one right now, I'll do another one in a month, and maybe my third one in December, and I'll be ready for the holidays. It's a resurfacing laser. Go ahead.
Yeah, well, I was gonna say the other reason that fall is kind of the time that we do these laser treatments is because I always say let's clean up the sins of the summer,
Right.
Especially this summer with most of us being, you know, in our backyards a lot more than we typically have been. You may have gotten more sun this summer trying to do outdoor activities. So now's the time to come in and to clean that stuff up, because every year if you can stay on top of these kind of things, your skin is going to age so much more healthfully and beautifully as well. So the Clear and Brilliant that we're going to show you on Tori, Tori struggles with some pigment issues that if I actually get too aggressive with the laser, I may make that worse instead of better. Clear and Brilliant is almost like a laser facial.
Mm-hmm. Right, and I love it because it's not painful at all. So I'm numbing right now. I'll only have to numb for 10 or 15 minutes, and then Dr. Holman's gonna do probably the Permea setting on me. It's a lighter setting. It helps more with pigment than anything, and that's kind of where my problem is. If you have melasma like me, we can always add tranexamic acid into it, just like we do with your microneedling when you have melasma, but it's gonna take care of a lot of my pigment, as well as do some resurfacing. So in 5 days, maybe after all that kind of sandpapering feeling goes away, I'll have cleaner skin, fresher skin, smoother skin, and lighter skin.
Yeah, and tomorrow she's actually going to look pretty great. I mean, you're a streetable essentially after this. So tomorrow she can wear makeup, those kind of things. She'll feel that sandpapery feeling, she said, for 3 to 5 days afterwards. But other people, even before that sandpapery feeling is gone, are going to look at her and be like, oh my gosh, your skin looks so great. It's a pretty neat thing. That Clear and Brilliant effect happens relatively quickly. What we're going to do today, I think it's a really important thing and something that I've done annually for really about the last 10 years. Before I knew I wanted to be a dermatologist, I had a real tanning bed habit. In fact, in college, I had—
Confessions of a dermatologist.
Yeah, it's really sad here. I had 2 tanning bed memberships in college, and that was because they wouldn't let you go to one twice a day. And so there was a good season of my life where I went into a tanning bed twice a day, had skin cancer at 24, and you know, and I've had several precancers both on my face and on my chest. So for me, this is not just reversing some of the damage that I've done, but it's just this constant maintenance, because really I'd be okay if my partners never had to cut a cancer off me again. Fortunately, my last one was on my stomach, but I don't want to see one on my face or my chest where cosmetically, you know, those scars are going to show. So the last 10 years, every year I've been diligent about doing Fraxel resurfacing to my face, neck, and chest. If you can believe it, things look better than they used to, but it's something that every year we're getting a ton of cosmetic benefits. So fine lines and wrinkles, I'm gonna get skin tightening, it's gonna make my skin glow, but there's a 1927 wavelength that also in quite a few studies been shown to treat precancers. And so in my mind, I'm getting a ton of cosmetic benefit, but I'm also getting a lot of medical benefit. But it's not a one-time thing. Like I said, every year this is something that I'm doing, trying to both clean up what I've done and just continue to do the maintenance and prevention. Because I'm protecting my investment now, I wear my sunscreen anytime that I'm out, those type things. But that old sun damage is going to continue to manifest itself as well. Resurfacing lasers, we're actually, if you want to look at it like on a microscopic level, we're poking holes in the skin, and as it heals, you know, we're going to do a Fraxel, which is called non-ablative. We're not going really all the way through, but then Tori's going to step it up just around my eyes a little bit, where we're starting to see some of those lines at rest that let you know I'm in my 40s, and she's going to go fully ablative, or fractionated ablative actually, go a little bit deeper to get a deeper resurfacing effect. I'm going to look like a hot mess, and I'll take pictures for Instagram and things tomorrow, and really, but over about 5 to 7 days, I'm going to heal, and we're going to add on top of it, which I do for anyone that does the erbium, microneedling with platelet-rich plasma, mine specifically, and we're going to microneedle that in, and it's actually going to decrease my healing time. So I would guess by this time next week I'm going to be back in makeup.
So we will post pictures on Instagram, so follow us to see that. But we will show you this video of Dr. Holman getting her treatment.